Come in.
Hello, my name is Jana. I'll be your nurse today, and we're going to be doing a heart and neck vessels assessment. I'm going to start with providing you with some privacy. Next, I'm going to wash my hands and put on gloves. If you could verify your name and date of birth for me.
Mackenzie Richards, 04/19/1999.
Thank you. To begin, I will be inspecting and palpating the carotid artery. If you could just look straight for me. Everything looks good. I do not see any pulsations or masses. Next, I will be palpating. I'll be feeling for those masses, pulsations, irregular heartbeat, any hyperkinetics, which is a abnormally fast heartbeat. I'll also be checking for those masses. Alright, everything feels good. I didn't feel any of those abnormalities nor any masses. Alright, next I'll be auscultating your carotid artery, and I'll just be listening for your pulse and your rate and your rhythm. Alright, everything sounds good. I can hear your pulse. It was about a 2+, which is bounding, which is excellent. I didn't notice any murmurs or hyperkinetics or that weak pulse. So next I'll be inspecting your jugular. You can lay down for me, please. If you could then look to my right. Alright. I do not see any pulsations. Your vein is not bulging. Everything looks good. No masses. Alright, great. If you could sit back up for me. Alright, next I'm going to sanitize my hands, and I will be inspecting and palpating your chest. From what I can see, your chest looks good. Your thoracic cage is even, no heaves or lifts. I don't notice any pulsations, and everything looks even. Next, I'll be palpating. I'm going to start with your precordium. I'm going to be looking for any of those masses, checking for any of those hyperkinetics or slow pulse. Everything feels good. Didn't feel anything abnormal. I'm going to move to your apical pulse now. I'll be checking for those same things, the pulse, the masses. Everything feels good. No masses, no edema, nothing abnormal is found. So next I'll be auscultating your heart sounds. I'm going to start with your first 5 points using the diaphragm of my stethoscope. I'm going to start with your aortic. Alright, I'm going to move to your pulmonary. Next is your Erb's point. I'm going to move your tricuspid. And lastly, your mitral. Alright, I could detect your pulse. Everything sounded good. There are no murmurs. Your rate and your rhythm was excellent as well. Next, I'm going to be checking to see if your S1 and S2 pulses are able to be auscultated. Your S2 is your base, and your S1 is by your apex. And I'll be using the bell of my stethoscope. I'll be checking for those murmurs or thrills or turbulence. Let's start the base. Use my diaphragm first and then my bell. And in your apex. I could detect your pulse, and now I will be checking for any extra heart sounds using the bell of my stethoscope. I will be checking your base and your apex again, as well as by your apical pulse. Your apex. And also check by your apical pulse. Alright, I did not detect any abnormalities. Your pulse sounded good. There are no murmurs or thrills or turbulence, which would be the rushing of blood flow. Right, everything else seems good and normal. Thank you and have a great day.